Hi, and welcome to Focal Point. My name is Carla Green. I am the director of the Regional Prevention Center at Kansas City, Kansas Community College. And we're going to be talking today about some of the health services that are available here in Wyandotte County. And with me is Rachel Jefferson of Quindaro Family Healthcare. And she's going to give us some information, some background information about the center, what drove them to come to Kansas City, what need they're meeting, and then some of the services that are available to our citizens. So welcome, Rachel.
Thank you. Thank you for having me.
All right, let's start with why you are where you are. What was the need that was in the community that that caused the Quindaro Healthcare Center to come to our county?
Well, as you may or may not know, the northeast area of Kansas City, Kansas is an area that is full of disparities and gaps in services. Particularly the 66101 census tract is a very low-income census tract. So when some other medical providers moved out of the area, there was a huge gap left for people that needed medical services. So Southwest Boulevard Family Healthcare, which has been in existence for about 21 years, decided to open a satellite site on 5th and Quindaro. And so that's the reason why we moved there, in order to serve people that don't have access to healthcare coverage. So our primary goal is to serve people that are uninsured or underinsured. And that's the reason why we opened our doors about 2 or 3 years ago.
Okay. So are you open just during normal business hours? Do you have evening and Saturday hours?
Actually, we are an after-hours clinic.
Okay.
So we're open Monday through Thursday, 3 p.m. to 6 p.m.
Ah.
What we found is that makes it a lot easier for people that have jobs or a second job, or have to watch their kids or pick their kids up out at daycare, to come and get an appointment, with that 6 p.m. being the latest that we would want to see anybody.
So it sounds like you all have done some research, so you know a bit about the demographics in that area. In addition to just not having health care available, what were some of the health care needs that residents had?
Well, we've seen a lot of people that need prenatal services, just youth services, immunizations. We have a lot of illnesses that have to do with heart disease and diabetes in our area. There's a general lack of exercise options available to people in our area. And so we decided, along with our medical services, to also install some exercise programming for older people, injured people. We do that Mondays and Tuesdays and Fridays, 11 to 11:45.
Okay. And our services, do I have to not have insurance to be able to get?
No, actually, it's quite the contrary. We do take private insurance. We take Medicaid and Medicare also, but our services are there for people that don't have insurance also. That's really why we opened our doors. Or their copay is too high, or the deductible is too high.
Can I use your services maybe instead of an urgent care facility?
Yes. Actually, what we want to become is a medical home provider for people, so they're not waiting to the last minute to see a doctor. They're not having to make that emergency room trip, which can be very expensive just because it's under the qualification of emergency care.
Right.
And so that's really why we're there, is so you can feel comfortable coming back and seeing a doctor that has your medical history, that knows what's going on with you, knows what's going on with your family, and you don't have to just pay these extreme out-of-pocket costs.
Okay. So let's say you mentioned some preventive care that you offer. If I've just had knee replacement surgery, what are some of the things that you could do for me?
Well, first of all, you'd want to see a doctor, but then I would suggest that you get involved in one of those exercise programs that we were talking about. We have a great exercise instructor that she actually has her degree in dance, and she has really geared those classes towards older adults and people that have injuries. And so the really low impact classes, you move a little bit slower, but you're still getting those benefits of constant exercise.
And it sounds like that's like a springboard. So you've gotten me started exercising. Once I've gone through, I don't want to say that program, but once I've reached a level, to which maybe I've outgrown the services that you have there as far as the exercise part, what are some options that I have? Can you recommend me someplace else in the community?
Well, I would suggest then that you try to get a membership down at our gym. It's also a low-cost gym down at Southwest Boulevard Fitness Center.
Didn't know that.
Yeah, we have all different types of programs there. It's a facility meant exactly for exercise, so they're able to offer a wider range of programs, and they also have a full gym and trainers and everything, so that once you become acclimated with our programs, and like you said, maybe you want to do something a little bit more, a little more often, or a little more strenuous, I would suggest that you look for a membership there.
Okay. So what are some of the community outreach programs that you have?
Sure. Well, we work extensively within the neighborhood and with the Oak Grove Neighborhood Association, which is the neighborhood that we are within, to offer a wide range of services. So we've been working to try to get trails installed in the neighborhood, to reduce crime in the neighborhood, to make ourselves available for job assistance referrals, rent referrals, utility referrals, just different stuff like that you would want to see a social service provider about.
Okay. So it's not just medical services that you're providing?
Absolutely not. We actually have a social service provider available every day that we're open at the clinic from 3 to 6. Okay. And they can provide you with those other services that I spoke of. They can also help you with the Medicaid or Medicare application. They can also provide you with counseling, if stuff's just getting too tough for you to handle and you just want someone to talk to.
Right.
And so, yeah, those are some of the services. We're just there to kind of help guide you. And then also, there are a lot of resources in the Wyandotte area, and there's not even a way for someone like me to know all of those resources. Right. So that's a great thing our social service providers do also, is that you can sit down with them and they can go through the list of resources and try to connect you with those different resources in the area.
Okay. On average, how many clients do you think you would see in a week? Well, not you personally.
Right, right. It really varies, but I say it could be anywhere from 20 to 30 clients depending on the week. We are only open those 3 hours, 4 days a week, so we have a certain maximum amount we can see. But then on the days that, our doctor is in, she can have anywhere from 9 to 14 appointments. On Mondays, Tuesdays, and Thursdays, we have an advanced practice resident nurse that's available. And he sees anywhere from about 4 to 5 people a day.
Wow, okay. Let's say I have young children and it's that time of year for immunizations. Is that something that you can do also?
Yes.
School physicals, all of those?
Yes, okay. Sports physicals, school physicals, immunizations, those are all things that we can do. We just suggest that people try to think ahead and make that appointment, because like everybody, when you wait to the last minute, it's kind of hard to get in to see someone.
Absolutely, absolutely. How long have you been in that location?
We're going into our 3rd year at that location.
Okay.
Yeah. And
we talked earlier about a gap in services, and I know that you were replacing some services that had been in the community. Do you know about the time frame from when those services left and you all came in?
I can't say specifically what that time frame was, but I believe it was about, maybe a year or so after that those services left and moved further out west that we came in.
Okay.
But don't quote me on that.
And from what you all know from your research, as far as, because obviously you realized that there was a gap in services, what was happening then to those clients who had been receiving services in that area, and then, like you said, the services moved out west, so maybe transportation could be an issue. Where were they going for care, or were they getting care?
Well, that's exactly it. I think a lot of them probably didn't get care. Okay. Or they were having to rely on the emergency room for their care. I think a lot of them went over to Missouri and the SWOPE services, which can be a very long trek for someone that doesn't have transportation. Right. I think at that point you're just trying to get in wherever you can get in, and you're making phone calls every day seeing if someone has a cancellation or a walk-in appointment available. And then if nothing else works, then you're just really staying sick, aren't you? Yeah, right. You're not getting what you need. And so it can be very difficult for a lot of people, especially since they have so many other things on their plate. What I like to call health stressors, things that can affect your health, but not necessarily in a direct way like a chronic illness could, or something like that. Stuff like, your rent's too high, so you're about to get evicted, or that water bill's due, or, it could go even so far as, you live next to a coal plant or something like that. There are a lot of things in your environment that affect your health that people don't think about, and that can cause you to not be able to really seek the health care you need.
Right. And so if I already have an issue such as high blood pressure, that's not going to help that situation.
Obviously, yeah, your high blood pressure is going to continue to be high or even get worse.
Right.
And then you're really affected detrimentally.
Right. Okay. Let's say that I have a chronic illness. that I have not received treatment for, such as maybe diabetes. Do you have any services that would allow me to get the medication that I need? Maybe I need to take insulin. How can you help me with that?
Well, I think there would be a couple of different ways that you could go through that, and the social service provider would be able to tell you better than I, but I know some of the things that we could do are probably either help you contact your prescription company, because prescription companies do have services available for people that can't afford their medication. It's part of what they have to do.
I didn't know that.
Yes, and then there are a lot of other organizations that will give away free diabetic test strips and meters and stuff like that. You just have to make sure that if you're getting a meter with test strips, it's test strips that in the end are affordable, because once you run out, you don't want to be back in the same situation that you were in before.
Okay.
But again, our social service provider would really be able to go over that full list of things that they could do for you, referrals and organizations that they could send you to. And then obviously we'd want you to join one of our exercise programs.
We keep coming back to exercise. That seems to be a big thing.
Well, it's really important, you know, especially in today's world where you have this extreme case of overweight and obesity in these communities. It really boils down to more than just exercise. Also, there's a serious lack of access to healthy foods in the area in which we are. So that means that you have to travel over a half mile to get to a grocery store where you can buy fresh fruit. So for someone that is on a time constraint or doesn't have that transportation, they're going to go to the corner store where they can get something cheap and fast and easy, instead of having to make that trek to the grocery store where maybe they can only carry 2 bags anyway. Yeah, so
that's a good point.
Yeah, and so I mean, it really comes down to lack of services, lack of the exercise option, lack of the grocery stores, that can really help improve people's quality of life.
Right. Okay. Well, thank you for sharing that part. We're going to take a short break, and when we come back, we will talk to Rachel a little bit more about some of the services that are available, and then also talk about some of the community partnerships that have been developed that just further enhance the services that are offered to our residents. So join us in a few minutes.
They said that Ritalin would help me focus. They lied. Find out the truth about Ritalin abuse. drugfreeworld.org.
Welcome back to Focal Point. I'm here again with Rachel Jefferson, and we are going to continue our conversation talking about the services that are available through Quindaro Family Healthcare. And so, welcome back.
Thank you.
We've talked about some of the services that are offered, and one of the things that you mentioned, we were talking about preventive care. You talked about exercise programs that are available, so you're helping me to improve my physical condition that way. What about nutrition? What services can you offer me in that area?
Well, we actually have a harvesters program that we've been working with. It's called Project Strength. It's an 8-week program where you cook with a group and learn some healthy recipes to maybe some of your old favorite dishes. And then at the end of each class, you get to take home a bag of groceries. So we actually had that program in the spring and summer, and then we're hoping to have one again in the winter.
Okay.
Yeah, so that'll be really nice.
And I know one of the issues in some of the areas in Wyandotte County can be access to nutritional foods. Are there any services that you can provide that would help citizens in that area?
We have transportation referral services. Okay. So, there are services available for people that have like Medicaid and Medicare that will take them places. We're also looking to maybe open some type of healthy food location ourselves, where we can provide some type of fresh food access and maybe install some type of cooking classes or something. Because what you'll find a lot of days is that even though you may give someone a variety of healthy foods, fresh onions, fresh carrots, fresh lettuce, they don't know how to put it together and make a meal from those raw products.
Okay.
And so you have to bridge that gap also. And so those are definitely some of the things we're looking to install, are like cooking classes to teach people how to bridge that gap and take it from raw into a eatable product, and then provide them with those those fresh produce also.
So how receptive are your clients to cooking classes? I'm thinking about my own family. Peach cobbler should have butter swimming on the top of it.
Yeah.
Pork chops were meant to be fried. What do
Right.
you do? You know, that's how I'm accustomed to cooking.
Sure.
How do you bridge that gap and try to lead me toward a more healthy lifestyle?
Well, you find at first people are a little tentative about trying new things.
I
but
can imagine.
Yeah, but once they get into it, they really are kind of amazed by what they can take out of a dish and add to a dish that'll make it healthier and still it'll taste good. You
Right.
know, the great thing about that particular program is that they cover all types of different dishes and even desserts.
Okay.
So you learn how to make some healthy desserts also, and they actually offer a whole bunch of free classes. You know, also along with those that you can kind of just do intermittently. You don't have to necessarily dedicate yourself to the full 8-week course.
Okay.
I think one of the great things about that program that really brings people in is that you do get that bag of groceries at the end of each class.
Right.
And so you learn how to cook with the food and then you're taking it home, you know.
And the food that I'm taking home, are those the same foods that I was using during the class?
Yeah, they are.
Okay.
Obviously not anything that's perishable.
Right.
You know, so the perishable items, they're not going to necessarily give to you unless they have those fresh that day.
Okay.
But the non-perishable items, yeah, those are the things that you'd be taking home with you. Wow. And you'll be surprised how much you can make out of the same things that you use to make something that's unhealthy for you, you could use to make something that's healthy for you.
Right. Do you have an example? Put you on the spot there.
No, sure. Well, I was just watching one of the classes and they made this risotto, you know, and so instead of using white rice, they were using like a wheat grain rice.
Okay.
And just by making that one simple change, you know, they really increased the health of the dish itself a lot.
Okay.
They had one particular dessert that was kind of like this strawberry shortcake type of thing. And I know it's, you know, it sounds dangerous, but just the materials that they used were lower calorie, lower fat materials, and it still tasted great, you know, with fresh strawberries. So there are a lot of ways that you can change things to make it healthy. And then they give you a recipe book at the end of the class, so
Okay.
it's great.
Wow. I might have to do that.
Yeah, check it out.
Tell me, where exactly are you located?
We're located just about a half block west of 5th and Quindaro, so we're actually located within McGrew Grove, which is actually a privately owned street in Kansas City, Kansas. I think it might be the last privately owned street in Kansas City, Kansas. So. Yeah, and we are within Faith Lutheran Church.
Okay.
Faith Lutheran Church is a church that's been in existence for a very long time, I think almost 50 or 60 years now.
Right.
And as the church congregation was dwindling, they needed, you know, to do something else to be able to keep the church alive. So the clinic was able to come into the church in the basement and remodel and pay rent to the church to help them keep the church alive. And then eventually we were able to buy the building from the church with the understanding that the church would stay there as long as they had a congregation to stay there. Wow. So now we have a very happy arrangement with the church where they have church every Sunday and they still do all their services, and it's very nice. And then our offices are on the top floor and our clinic is on the bottom floor.
Wow. So do you have any partnership activities with the church?
We do. Actually, we're kind of going back to nutrition. We're trying to partner right now on another program. It's like a box meal delivery program. I don't know if you've ever heard of it, Angel Foods.
Yes.
And so it's a very great program. It's one of these things where you can use your food stamp card or EBT to order a box of food that's fresh food, you know, packaged fresh food, and you just get a great deal for your money, basically. I mean, $25 to $50 can feed a family of four for a week or two or something like that. So that's just a great value for your money. And we're hoping to be able to install that program with the church, using church volunteers and then our staff to bring that to the community.
And would that be available to anyone? If I don't have food stamps, can I pay cash? Can I
Absolutely.
check? Okay.
Yeah, you can pay cash, and then we're deciding right now whether we're going to be able to take credit card, but for sure we know we'll be able to do cash in the food stamps.
Okay. So I know you're collaborating with the church. What other community collaborations are you all involved with?
Well, we're actually a part of Connect the Dots, which is one of the regional prevention center programs. I've been on Connect the Dots for about a year now. And one of the things that my subgroup has been working on is a youth substance abuse prevention program.
Okay.
It's really important that in today's times we look at substance abuse a little bit differently than we have been. This kind of like lecture style to youth, telling them why it's wrong, is not necessarily working.
No.
Yeah. And so one of the things we're trying to do is bring a different kind of outlook to this program, where maybe the kids can talk amongst themselves and in a group of their peers work for themselves why drug use is bad based upon what their future goals are, what their ideals are, and just kind of come to the conclusion themselves why they should try to stay away from that, which is really the only way that that's going to be a sustainable type of program anyway. And so the program focuses on raising the protective factors in a child's life and lowering those risk factors. Right. And so the kids, by having this peer group, they get a bond with the peer group, they get a bond with the school, and then through that they kind of have like a protection that they don't have to feel like they have to be cool to and use drugs to be cool, basically. Right. They know that there's another option for them. And for a lot of kids, they don't know there's another option for them. That may be all they've ever known. And so it's important for them to be able to see that they have a hope, they have a future, and for them to have some ideals.
Okay. What subgroup are you on?
I'm on the youth prevention.
It is
substance
youth
abuse
prevention.
prevention program subgroup. Yeah.
And I have to say, I am so excited about the subgroups in Connect the Dots because you all are just taking off. I was just talking to a staff member this morning about all of the things that you all are doing, that you're planning, and we're like, okay, now it's time to do something.
Yes.
So what are you all planning to actually do? I know you've talked about the program. Where would you implement that program?
Our goal is to implement it within the USD 500 schools.
Okay.
We hope to pilot at least one program in one school, and then throughout the program invite other schools to come in and see how it works. And by doing that, they can decide for themselves whether or not they think that program would be good for their particular school.
Okay.
Yeah, but I think it's a great program. I think it has a huge chance of success, and so I really am excited to see how this pilot works if we can get it off the ground.
And you may not know this, I don't know if you're this far in the planning phase, but would it be something that would be done during the school day, or is it after school, before school?
I don't have that information right now. I think it would probably be during the school day, just because you do have to have a classroom monitor there that can kind of lead the conversation if the conversation gets off track. They're not an intrusive presence. They very much let the kids, decide for themselves and everything, but just to kind of guide the conversation and everything. So you'd probably be during school or maybe after school.
What is there a curriculum that you would use?
Yes. We're looking at a All-Stars program, which is a SAMHSA evidence-based program. And one of the groups that we're working with in the subgroup, TLC, has actually been trained on this program, and so hopefully they'd be able to pilot it in one of those USD 500 schools. Okay.
What age group is the program geared toward?
It's going to be geared towards 6th and 7th graders.
Okay. So
yeah, it's that transitional age that's really important, that you get them right before they enter high school, and try to instill those values in them so that when they do enter high school and it's kind of like a whole new world of, whole new options out there, they can still have those core values that they can look back on.
When you were talking earlier about the services that are offered, I thought about just the community collaborations right there. So let's say, if I come into the healthcare center and I'm looking for, maybe I'm having an issue with SRS, do you have someone on staff who's specifically helping you with that, or are you reaching out to someone in the community who has that expertise?
Actually, in that particular case, we do have someone down at our main clinic, the Southwest Boulevard Clinic, that's available on Thursdays to enroll people in those SRS programs. And it's a lot easier process because you can enroll people and then they know right then if they're denied or accepted. Yeah.
I know one of the purposes of Connect the Dots as a community coalition is to bring all sectors of the community together, because there's no one person who has all of the answers. And so it's really amazing to me to see the work that you all are doing, and you really are branched out. When I think of a health clinic, I'm thinking, okay, I can go there and I can get a shot, or I can get a pill or something like that, but really providing those wraparound services for the community. Did you mention mental health also?
Yes, the mental health would be one of the things that our social service provider could provide you with. The clinical side of that would be able to provide you with like some psychotherapy and stuff like that. And then anything beyond that, we have referrals that we could provide. The doctor could work with the social worker to prescribe you something that you would need. That would be up to the doctor, obviously. But yeah, we do have mental health services because that's very important, and especially in that area. Mental health problems are kind of looked down upon and are not necessarily discussed. And so it makes it even more detrimental to your health if you're keeping it inside, so you don't have to feel like you have to live like that.
And there's that, as you say, there's that stigma that's attached to it.
Yes, there is. There is, and it's really, it's part of the culture, but it's unfortunate. And so in a lot of ways you have to try to dispel that,
right,
so that people can get the help that they
right,
need, Yeah.
Well, I thank you so much for coming in today. I think you all do wonderful work. I'm amazed at the things that you're doing and the services that you're providing here in the community. And I do hope that you will remain an active part of Connect the Dots and we can keep our partnership going.
Oh, I think I'm the co-chair, so
okay.
I think I'm going to be an active part of it. Yeah, for at least till they choose a new one or something, I'll be there.
That's good to hear. Good to hear. Tell me one last time, where's the clinic located?
Sure. Quindaro Family Healthcare is located at 530 Quindaro Boulevard, Kansas City, Kansas 66101.
Okay. And the hours that you're open?
Monday through Thursday, 3 to 6, and we are a Wyandotte County clinic, which means we serve people in Wyandotte County,
okay,
specifically around that 66101 to 66107 zip codes.
Okay.
Yeah.
Thank you again.
Thank you for having me.
It's really a joy.
Yes.
And thank you all for joining us again on Focal Point. We'll see you next time.